from Hartford Healthcare's Tina Barona. Thank you so much for joining us in this Facebook Live session. I am joined by Dr. Jeff Weiser. He's a gastroenterologist at Hartford Hospital. Thank you so much for sticking around after your live interview on Channel 3.
Thank you for having me.
We appreciate it. So if you just saw Dr. Weiser's interview, we're going to continue the conversation here on Facebook. There was a study, the results were just released yesterday, which is alarming and interesting at the same time, that younger people are being diagnosed with colorectal cancer. Talk to us about this study, its findings, and why we should be concerned about this.
Well, there are two significant findings of the study. First, there's good news, is that the rates of colon cancer have dropped in the older population, not being that old, but over age 55. The alarming part is the increased detection or increased rates of colon cancer in those under 55, particularly people in their 20s and 30s. And the big question is why? Why are we seeing this? And the study really doesn't come to a firm conclusion. This is more of an observational study. But there are several ideas that were proposed, and these are largely based on environment. And so what do we see? What have been some big changes in our environment in the last 20, 30 years? Unfortunately, obesity has become more epidemic, and obesity has been linked to a number of cancers, including colon cancer. So that might be a significant risk factor here. Other environmental risks include smoking, a more sedentary lifestyle. So these are all risk factors that might be increasing the rates of colorectal carcinoma in young people. And conversely, by mitigating these risk factors as adults, getting to a healthy weight, exercising regularly, stopping smoking, we can decrease our risk of colon cancer. Now, that being said, there are unfortunately individuals who are diagnosed with colon cancer who live healthy lifestyles, who don't smoke, and that's concerning as well.
Yeah, are you surprised by these findings?
I am a bit surprised, but we certainly see in our practice younger individuals who've developed colon cancer. And what's challenging in these individuals is it's a surprising diagnosis when we find it, and symptoms which might otherwise trigger an investigation in someone who's older, in their 40s or 50s, might go undetected or passed over by the patient or even the physician. Rectal bleeding is one significant symptom. And rectal bleeding is commonly caused by hemorrhoids or fissures, which are not, in general, dangerous conditions. And in most cases, in a 20 or 30-year-old, the bleeding will be from a hemorrhoid or a fissure. However, there are exceptions where the bleeding can be from a precancerous polyp, inflammation of the colon, or cancer itself. And it's for these reasons that bleeding should not be ignored and should be evaluated.
And check your doctor. We're, of course, talking with Dr. Jeff Weiser. He's a gastroenterologist here at Hartford Hospital. We are doing this Facebook Live session, so we encourage you to ask a question, and we will, of course, ask the doctor and get those answers for you. I want to talk about, you mentioned obesity, and that could be one of the contributing factors. How is that? Diet, obesity, how can that lead to cancer in younger people?
Similar ways it would increase the risk of cancer in older people. It may increase or decrease the way the body will regulate cell production and prevent cells which normally should be checked and allow them to go unchecked for longer periods of time.
Yeah. Colonoscopies. March is Colorectal Cancer Awareness Month. Colonoscopies is something very important, vital for detecting cancer, but not something that people like. They sort of dread getting colonoscopies. How do you get them around that curve to really stress the importance of this? It's a life-saving tool.
It is a life-saving tool, and I'm fortunate by the time the patient comes into my office, they kind of know what to expect. I think the primary care docs, the internists, the family practitioners, the nurse practitioners, they have the harder job. They need to get that patient into my office. A colonoscopy, for a lot of people psychologically, it's a bit embarrassing. It's something people don't like to talk about. But the examination itself is very routine for us. It's not routine for the patient. It's probably the first exam they've ever had of that nature. But during the exam, they are very comfortable. We use a medication called propofol given by our anesthesia team. They are very comfortable. They are asleep, and the exam is really painless. That being said, once in a while, we'll have patients who want to have the examination fully awake. something I don't encourage, but if that's what the patient
You wanna know
wants,
what's going on.
we'll get them through it.
Right. And I think it's probably the prep the night before, which you can do in the comfort of your own
Mm-hmm.
home, which makes it a little bit better. But I think that's what gets people scared is that
Yeah,
prep.
there are various different preps out there and different solutions. Some are prescriptions, some are over the counter. The goal of all of them are the same. It really is to clean out the stool, the residual contents from the colon to allow a good, thorough examination. I really can't overemphasize the importance of the bowel preparation in terms of the quality of the prep of the examination that will occur. Yeah, it is a bit uncomfortable. There's a lot of time in the bathroom overnight, but this is really doable for patients.
But one good thing is that when you have a colonoscopy, you wouldn't have another one until 10 years because if you do have polyps, you were talking about the time that cancer could develop would be 10 years.
That's overall true. The recommendations for average risk individuals who have had negative examinations, for example, if someone's 50 years old, which is the age of screening should begin, they have a quality examination, good exam, good prep, no polyps. As long as they remain symptom-free and don't have any changes in their family history or personal history, their next examination would be at 60 and then at 70. However, if during that examination at age 50, a polyp is identified, particularly a precancerous polyp, those recommendations are going to change. Usually, if a polyp is identified, examination would be in 5 years, some cases 3 years, some cases 6 to 12 months, and those are individual situations.
And if you have a family history, you could potentially start earlier at 45?
45, 40. Guidelines depend on the age of the family member who was diagnosed. Oftentimes it's 10 years younger than the age of diagnosis of that family member. Again, but that's a case-by-case decision.
Okay, we're of course talking with Dr. Jeff Weiser. He's a gastroenterologist at Hartford Hospital. We do have a question. The question is, if you have a family history of colon cancer, should you make lifestyle changes, and what changes do you recommend?
Well, the lifestyle changes I would recommend are general positive changes that would help prevent a number of conditions. So lifestyle changes I would recommend, the first one would be stopping smoking cigarettes, which will increase the risk of colon cancer, pancreatic cancer, lung cancer, heart disease, and the list goes on and on. So I would say that's the first and foremost. If someone is overweight, getting to a healthier weight would be beneficial. Exercise might be beneficial as well. As far as what foods to eat, lower red meat might be helpful. Increasing fruits and vegetables, fiber in particular, may be helpful. But unfortunately, none of these interventions will guarantee preventing colon cancer.
Now, there are a number of classes that Hartford Healthcare is offering on this topic of colon cancer, colorectal cancer. It is Colon Cancer Awareness Month. We encourage you to call the number on your screen, 1-855-HHC, here for a complete list of those classes. And of course, if you would like to register for any of those classes, we invite you to do so. Let's talk about symptoms of colorectal cancer, because these symptoms could really almost be anything, right?
Well, I'll describe some of the common symptoms, but then I'll describe the most common symptom. Common symptoms are change in bowel habits, narrowing of the stool, rectal bleeding, and abdominal pain. Those are kind of classic symptoms. But the most common symptom that we would find if we find a colon cancer on a screening colonoscopy is no symptoms. Colon cancer is usually present for a significant period of time when the patient feels totally well. That's the time we'd like to diagnose the colon cancer while it still is an early stage. By the time symptoms develop, the change of bowel habits, pain, bleeding, anemia, that generally means that cancer has had time to grow. And the longer the cancer is there, the larger it gets, the deeper it gets, the lower the success rate in terms of having an uncomplicated surgery and having the tumor removed in one procedure. And the procedure we generally are talking about is surgery. Identify the cancer, send the patient off to a surgeon. We will do a staging, which usually will involve a CAT scan and an X-ray. And if everything if there's no evidence of metastatic disease, the surgeon will remove the tumor along with normal colon on either side of the lesion and anastomose or sew the ends together. So for an elective procedure, a patient is in the hospital 5 to 10 days, depending on the type of surgery that's done. There would be no colostomy or no bag. And after a period of recovery, patients should lead a normal life.
Yeah, and let's talk about once they have the procedure. You talked about the recovery, you can make a full recovery. I think what's also important to mention here is that this is highly treatable, if, like most cancers, if caught early.
It is very treatable. Colon cancer caught in early stages, well over 90% cure rate. And I'm talking about cure rate with surgery, without chemotherapy, without radiation therapy. However, the more advanced tumor is, the later stage a tumor is, the therapies are going to become more involved, chemotherapy in particular, and the rate of metastatic disease, unfortunately, does go up.
Yeah. The key here is rectal bleeding. If you do discover that, don't try to diagnose it yourself. Don't think, hey, it's a hemorrhoid. Go and check that with your doctor and have what's the screening process like? If you come in and say, Dr. Weiser, I have rectal bleeding, what happens at that point?
Well, if somebody comes into my office, we'll talk about it, and we'll try to diagnose the problem in the office. There's certain patterns different diseases will have in terms of presenting with rectal bleeding. Usually will involve a rectal examination if the patient is comfortable enough with that in the office. But almost always I will recommend some type of evaluation of the colon itself. If someone is very young, traditionally we've offered a shorter examination called a sigmoidoscopy to evaluate rectal bleeding. However, with this study, we might have to change our recommendations to go straight to colonoscopy.
Yeah, and so the colonoscopy, they would have that. The results are pretty immediate. What's that like?
We tell our patients the results immediately, pretty much as soon as they wake up from anesthesia, which is usually well under a half hour. We'll tell them exactly what we saw, what we didn't see. If we took out a polyp or we did a biopsy, that's going to take a few more days, usually within a week till we get the results from the pathologist.
Now, if it comes back and you diagnose the patient with hemorrhoids, is there further testing beyond that, or do you stop at that point?
No, we would stop at that point. If somebody has rectal bleeding and we see hemorrhoids on the examination and we don't see anything else, we would attribute the bleeding at that point to hemorrhoids, unless there's something particularly unusual about that patient. And hemorrhoids are generally treated with diet, and there's certain topical remedies. If hemorrhoids are particularly bothersome or they're refractory to medical treatment, there are treatments that are available. Some are administered by gastroenterologists, and others are administered by colorectal surgeons.
Let's talk about some of the myths out there. Can hemorrhoids lead to cancer?
No, hemorrhoids do not lead to colon cancer. They do not lead to rectal cancer. However, both hemorrhoids and rectal cancer and colon cancer can present with bleeding. So one may have hemorrhoids, and we have seen this, but also can have a malignant polyp or a large polyp or cancer simultaneously.
And what do you do at that point? If someone comes in, do you do that further testing if you think it's a hemorrhoid, or it is a hemorrhoid and there might be cancer there? Do the symptoms differ?
Symptoms do differ to a degree, but you don't want to assume something is just a hemorrhoid and then later find out it was something much more serious. So we generally will recommend that bleeding be evaluated. If we do an examination, we find nothing else concerning, that is perfectly reasonable at that point just to treat the hemorrhoid.
Do we know what's causing the cancer in younger people or colon cancer in general? Is it diet?
Well,
is it environment?
Yes, I think a bit of both and some genetics. There is a sequence, it's called the adenoma-carcinoma sequence. Most colon cancers will begin as precancerous polyps called adenomas. And adenomas are very, very common. About 1 in 3 individuals as adults will develop a precancerous polyp. Now, the majority of these things will not develop into cancer, and they will stay precancerous polyps for the rest of the individual's lives. However, some of them will turn into colon cancer. So what we want to do is remove that polyp before it has developed the chance to develop a colon cancer. And for the cancer to develop, there usually is a sequence of genetic changes that will occur. The more changes that occur, the higher the rate of colon cancer.
So I think the takeaway here is that early detection is key. If you have rectal bleeding, check with your doctor. And because it is curable, it's a treatable cancer.
It is absolutely curable when caught early, and it's always treatable.
Good advice. Thank you, Dr. Weiser, for joining us. As I mentioned before, there are a number of classes that Hartford Healthcare offers in colon cancer. Just call that number on your screen, 1-855-HHC, here for a complete list of those classes and, of course, to register. We thank you for joining us for this live Facebook session. I'm Hartford Healthcare's Tina Verona. We'll see you soon.